Welcome to the Physician Innovator. I'm Chris Trimble and I'll be your host. I'm coming at you today from my office here at Dartmouth, and all I want to do in this short video is introduce you to what we are up to. In brief, we're trying to catalyze innovation in healthcare delivery, but I think a little bit of background and some narrowing of focus will be very helpful. I've studied innovation without any particular industry focus for many, many years before deciding several years ago to focus on healthcare delivery in particular. And I tell you, it's been the most meaningful work that I've ever been involved with. I love it. One thing that I'm sure that you know is that by comparison to other industries, healthcare is very peculiar, and peculiar in a lot of different ways. I want to highlight just one dimension of that strangeness, and that is that healthcare is a completely uneven playing field for innovators. For some kinds of innovators, the sun never sets, while for others, the sun never rises. Well, the game is changing. Thanks to reforms in the payment model, the sun is finally rising on a very particular class of innovations that is our sole focus. You know, as a nation and as a healthcare system, the innovations that we ought to be most excited to get behind are those that can deliver what you might think of as a double win. That is, they simultaneously improve outcomes for patients and they reduce system costs. Let's go way back in history to consider one such double win, and that was penicillin. This was the miracle drug, of course, that introduced the antibiotic era, and it did in fact deliver that double win. It was an inexpensive pill, and it was curative and therefore avoided downstream care, better outcomes, and lower costs. But the fact is that biomedical innovations these days almost never deliver double wins. That said, there is an entire class of innovations, that can deliver double wins. Not only that, this is a class of innovations that's not highly scientific or high-tech. In fact, these innovations are based on familiar, common-sense principles. Furthermore, these innovations are ones that have the potential to reinvigorate the careers of burned-out physicians. Furthermore, they only require modest risks and modest-sized investments. There's opportunities for innovations like these all over the country, in every health system, in every medical condition. And yet, despite all of this, these are opportunities that we have been bypassing quite literally for decades. Now, you may immediately be wondering, come on, Chris, how is this possible? And I hear you. And in fact, if I made outrageous statements like these in most any other industry, I'd get thrown out of boardrooms. But it really is true in healthcare. And it is true because there are some very idiosyncratic barriers that only exist in healthcare. The biggest of all is our traditional fee-for-service payment system. And to see that, all you have to do is think about a possible innovation that you might come up with. A new service to take better care of your patients. I don't know what the new service is, but it might be a home visit. It might be a televisit. It might be a way to continuously monitor your patient's health conditions. But whatever it is, let's imagine that you do in fact deliver that double win. Better outcomes and lower costs. Well, hey, in my book, you're a hero and you ought to be rewarded for that great work. But the reality is, under traditional fee-for-service payments, you get zero. You get exactly zero. And not only that, you're probably going to get penalized by reducing the volume of services that your clinic or your health system delivers. Why keep patients healthy? It hurts business under traditional fee-for-service payments. All of this is, of course, insane. But the good news is that slowly but surely the payment model is changing and new doors are opening for the types of innovations that we are so interested in here at the Physician Innovator. Okay, so I'd like to zero in just a little bit more closely on the specific innovations that are of interest here. Keep in mind, earlier I said that these are innovations that require only modest risks and modest size investments, but they do require investments of a certain minimum size. I've seen that big leaps are possible from innovations that take the form of a small but full-time clinical team. That is, a small but full-time clinical team that redesigns care and delivers better care for a particular patient population. So, for example, we might be talking about 3 or 4 clinicians that full-time care for a panel of, let's say, frail and homebound elders. Keep in mind, we're talking about innovations that are grounded in familiar common sense principles. Technology sometimes does play a role, but we're not talking about things that would be regarded as high-tech or scientifically cutting edge. What we are talking about is small but full-time clinical teams that redesign care and deliver better care for a particular patient population. Notice I keep saying clinical teams that deliver care. We're not talking about innovation teams in the abstract here or think tanks. We're not talking about teams that come up with ideas and do research and write proposals. We're talking about teams that deliver clinical services for a particular patient population. There is great power in innovations like this, and in fact, my prescription for fixing the system is to catalyze a groundswell of literally tens of thousands of physicians leading these types of efforts. You know, perhaps the most important thing that we do here is feature stories about people who are already doing this kind of work. Physician innovators who have delivered or are well on their way to delivering a double win. I admire these people. These are my friends, and I'd like to tell you just a little bit more about them. First of all, they are compassionate doctors. They care about their patients, and because they care about their patients, they are frustrated with the way the system falls short for them and even wastes money in delivering poor services. But they are also optimistic doctors. They believe the healthcare of tomorrow can be better than it is today, and they want to work hard and they want to be agents of change. I want to say one more thing about these people, and that is, while they're certainly well above average, you wouldn't call these people rare geniuses in the sense of a 1 in a million like a Thomas Edison or a Steve Jobs. These are entirely normal people, impressive and normal. I'm going to show you a collage of 10 people who are already doing this kind of work, but my belief is that under the right conditions, there's no reason that this collage couldn't expand to tens of thousands. So again, our overall mission here at the Physician Innovator is to catalyze a groundswell of tens of thousands of physician innovators nationwide. Now that may sound like an absurdly large number, but it truly isn't. Keep in mind that that's a small percentage of the nearly 1 million physicians in the country, and it represents just a handful of initiatives per hospital. It's a very reachable number. I'm here because I believe I have at least a modest contribution to make. I have spent my career studying the managerial challenges of innovation inside of established organizations, and I believe I have some insights that are relevant to physician innovators. But having said that, I believe you can learn far more from each other, physician innovator to physician innovator. And that is why the most important thing that we do here is write a feature story each month about a physician innovator's work, and then host a live online conversation with that physician innovator that I encourage you to join. Thanks for listening today. Please send me your thoughts, send me your feedback. This must be a team effort. I look forward to working with you.